for example, the absence of data on key state variables, like for the SIR model, we don't regularly observe and calculate the number of susceptibles, though Brian, of course, will help us change that with his serology. And then interesting also kind of subtle challenges about the disparity between key state variables and observed quantities. So for example, typically the real data is incidence, which is related to, but obviously different than the prevalence, which is the key variables in the mathematical modeling. Now, I think a less obvious, but maybe very, very important, at least from a historical perspective, challenge was that I think there was an interesting general wariness at the time to what extent a model should, to what extent we should hope that a model could give any kind of quantitative match to data.
Am I right in thinking that shouldn't have the first E?
It's wariness.
It's not wary.
Oh no, this sentence is in Norwegian. Anyway. Okay. So I think at least I am among many of us converting the audience that have great expectations of a match between models and data. And so, for example, today, I think at least a lot of us think that if we're working with fairly simple disease dynamics, for which of course measles is the one of the poster children, then our expectations is really that a good model should fit enormously well. And this is just throwing this out. This is just one version of a simple model fit to the measles, England and Wales. And the red here is the data, and the black is the prediction of the model starting with initial conditions in 1944 and running, predicting it for 94 years, for 50 years forwards in time, which represents a little bit over 1,000 generation of the dynamic process. And it's a good fit. There's some discrepancies, but you even by knowing the number of births and where you were in 1944, you can capture key strange behaviors of the dynamics 30, 40 years hence. And similarly, and I should say, so this is the prediction of the TSR model, which is my kind of the world that I've lived in, the bubble I've lived in. And so it's maybe not everybody live in the same bubble. The TSR model is just an acronym for a very slight twist with some subtle idiosyncrasies of the chain binomial of Bailey, Norm Bailey, from 1957. So it's a subtle change of the chain binomial, and then with just the added complication that there is seasonality in the forcing, in the transmission rate because of term time forcing and frailty in the demographic mixing. Okay, and I think similarly, so I just threw this up. It's not a perfect illustration, but similarly now, since particularly Jess Metcalf and Petra Klepas has kind of included the whole next generation and age-structured formalism into this machinery, we now have similar expectation for very, very detailed match between data and model simulation, also for age-structured data. And so the reason why they look quite different here is because I wasn't able to I didn't have the raw data, so I can downsample the underreporting from the modeling. But it's generally, you can see here that that's a nice mix. And I think so. That's kind of where we are today. But I think it's interesting that we're actually quite a long way from where we were 20 years ago. In that, so this is a quote that I dug up just yesterday from Mark Cott and Bill Schaefer, who I think was who were they were interesting in that they were some of the first people that say, hey, you know, mathematical models, we're making all these predictions, mathematical models some of these predictions should actually have some relevance to the real world. They nevertheless, in that first paper where they said that, it should have, they make this great elaborate disclaimer where they say, though of course as a practical matter, it is unlikely that population dynamicists will ever be able to do something that will be useful to the real world. And of course, for infectious diseases, those complications include things like age-directed mixing, age-specific seasonality in transmission. Some part of the population goes to school, some part of the population does not. Core groups, heterogeneities, etc., etc., etc. So lots of complications, and I think it's instructive to just look at how we got from that perspective, which was a pretty frank but much less ambitious perspective of then versus none. And so here is my rewriting of history. So I think what's happened over the 20 years is that we've gone through this interesting transition where, starting there with the perspective of Markov and Bill Schaefer, I guess George Sugihara and others said, okay, so we know these data can have no relevance to any, these models have no relevance to any real data, but there must be some qualitative relevance of the conclusions, which I think interestingly led to the early developments of things that we maybe laugh a bit about now. But for example, the attempts of using non-parametric forecasting to distinguish between cycles and chaos in data, because there was the possibility the model predicted that under certain conditions, the SIR model, seasonal forced SIR model, predicted that dynamics can be chaotic, and other conditions it be limit cycles or stochastically excited resonant cycles. But interestingly, as you can see now, George Sugihara and Bob May, who are key theorists, some of the most important theorists in our field, interestingly, despite that, you could see that their first step was to go completely non-parametric when looking at these things. So not willing to lean on any of the assumptions that we routinely make for our models. But I think it's very, very important. And so that was interesting. And then I think the next step, so that was, there's obviously lots of people here in the audience also that's been involved in this process. And then I think by mid-90s, there was a subtle change where it says, how about we try to believe a little bit, let's see if we could manage to reconstruct some of these unknown state variables like the susceptible class. How about we try a little bit to be as ambitious as to compare data to models, which led to and Steve Alner was very important in this area, to the development of semi-parametric models with smart embedding, and then also the susceptible reconstruction, which Bobachev and also Barbel Finkenstein did work on. And then from there, I think then once we were kind of willing to jump into the deep end of the pool and really try to take our mathematical models as face value, then it was, and I think Barbel was the one that did wonderful, very insightful thing, and just said, well, you know, if we take the chain binomial model, we can recast it as a non-autonomous autoregressive model that we can fit with data. And then I think there's a lot of other things. So I think there were a lot of other interesting things that went on along the way that I remember, because so I guess I started playing a little bit in the field around this time, where there were lots of interesting, complicated conceptual issues that we were dealing with on the way, and I think for many of us, you know, the first thing is, why the hell does the TSIR seem to fit the data from for England and Wales? It makes no sense. It's got no age structure. It's got all these other complexities that it's ignoring. Why is it of any use at all and use it all for prediction, which I think interestingly led to what is one of Brian's very many wordsmithings, which was the notion of emergent simplicity, and then the dynamic homogeneity of David Oon, just trying to think conceptually about why age-structured, high-dimensional age-structured dynamics sometimes can collapse on something simpler. And then, of course, then we are kind of where many of us are today, which is where we really think that these simple models should, in fact, be relevant to dynamics, and of course, with enormous and wonderful methodology developments to get better and better at fitting in the models. And so this is kind of just the summary from this this first part, which is that surprisingly some models are much less wrong than we really were expecting them to be. And this is just a pet peeve to me that so I completely disagree. No, that's not true. So computers have been a wonderful thing, but it's not been the important driver in this arena from my perspective, because it was working through all these complicated conceptual issues that's been even more important than fiddling out algorithmics. Because I remember, so the MRC unit in Cambridge released, I can't remember, was it version 0.2 or something of bugs in 1994? Yeah, somebody might correct me. So I mean, so the MC hierarchical base has functionally been around for as long as this has. Okay, so that was my soapbox. Okay, so what do I think are what do I think are the current challenges? So I think there are. So I hope I've convinced you all that I'm a great believer of simple models being useful for public health, at least for understanding dynamics. Now, I think I want to highlight very quickly 3 issues that I think are really important for the future. And so I think the first important one that I want to highlight is, let's take these models at face value and really explore them dynamically, and to try to learn about, I think, what we've seen in various case studies that there's seemingly numerous unanticipated side effects sometimes of intervention-induced reduction in circulation of certain pathogens. And I think that's something where these models could really help us in a systematic way to think more carefully about. We had Jess, of course, talked beautifully about the issue about intervention against rubella and the possibility of congenital rubella syndrome. There's other things are the speculation that the use of the chickenpox vaccine might increase shingle incidence, where the notion here is that the circulation of chickenpox may in fact help maintain immune memory against the virus, so as to prevent reactivation of the herpes virus. I've done I think a similar case study that I've been involved with, that I've got an enormous number of slides that I'm going to not show you now coming up. It's the issue about whooping cough and the re-emergence of whooping cough, because they're an interesting case study that we've seen in many places now, like for example in Massachusetts, is that we saw enormous success early on in the control of whooping cough, and then a strange re-emergence that we don't really understand. I don't know to what extent that re-emergence has happened here in the UK. It certainly happened in the US and in Norway, where I'm from. And it's a curious re-emergence, because there's no particular change in public health policy. In Massachusetts at the time, there was no change in vaccines cover. There was no vaccine scare. The change from the whole cell to a cellular vaccine was in 1997, and you can see the nadir in the case load was in 1975. So there's no obvious correlate of why this has happened. There's been some speculations that it's a vaccine-driven evolution. The studies of Fritz Moy that was discussed earlier. With respect to whooping cough, we've been I'm going to have to fast forward on this one. So we've been at least thinking about 3 minutes. We've been thinking about the idea that maybe something like the zoster ideas, where circulation and re-exposure might maintain immune memory, could be a potentially important thing. With whooping cough, similarly to rubella, there is the possibility that the notion of using booster vaccine might, instead of improving things, might push disease further into the age of adults with childbearing age, in which case perinatal infection, which are the thing that we're worried about, might get worse rather than better. So those are just a couple of examples, I think, of things that would be very useful to use this clever model to think about what may and or may not happen that's desirable in the face of vaccination. The second thing that I just want to highlight is that I think there's an enormous need to think about robust forecasting in the face of rapidly changing demographies and vaccination schedules. Here is just an example that I borrowed from Matt Ferrari, who's collaborating with CDC China. And China is obviously a really interesting example, for example, where there's just been enormously rapid demographic changes. So first you had the vaccine coming in, MCV1, introduced in late 70s, then EPI in, so the usual changes in vaccination. But then, of course, there's crazy changes in the demography when the one-child policy was introduced, where birth rates suddenly were, fertility rates essentially were reduced by 70-80%. And so we need to think about that. And obviously, the key take-home message here is that the only thing that can help us do forecasting in the face of such non-stationarity is mechanistic models. So it doesn't matter what non-mechanistic models can do in terms of hindcasting history. The mechanistic models is the only way to go there. So that was, I guess, my second soapbox. And then the third challenge that I think is going to be very, very important is to take these models, make sure that they're parameterized to as best as we can so that we can believe in them. And then we really need to think about projecting possible and probable buildup of susceptible pockets in the face of imperfect vaccinations, because another thing that has surprised many of us, again with measles, is that in many countries, when we have had good measles control for a long time, suddenly 5-10 years later we get major epidemics in what used to be not core age classes. And it's happened in Brazil and recently in Burkina Faso and many places. And that's because of the slow build-up of susceptibles that we're failing to mop up for whatever reasons. Now, the one important challenge, and I'm going to throw this challenge out to the statisticians in the room, is that these mechanistic models are great. I believe they work. We have an enormous machinery to fit the models, but they were not designed by statisticians, they were designed by biologists. And so what that means is that very often there is enormous multicollinearity in the system when you fit it, which means that two quite different parameter combinations can fit the current data, your data in hand, equally well. And so that's not, I know you're going to come hit me on the head now. They can fit and you know, and that's fine. It fits equally well. We can live with that. But of course, they're going to give very different predictions and forecasts for the future. And so we need to find a way to anchor. Here's an example of a likelihood ridge that goes right down there. There's pretty much no difference in the likelihood as you go down that ridge. We absolutely need to find a way to anchor these models, estimates somehow, because it's critical where the truth is relative to forecasting into the future. And of course, serology, auxiliary data might be a way to go. And that's all I wanted to say.
Quick partial answer to your question about whooping cough is that I thought it came back in Britain because the vaccination levels went down. So I saw my own children in the late 1980s. I even caught it myself. My mother, who's in public health, was very indignant because she'd had me immunized as one of the sort of pioneers 40 years earlier. So,
yeah. So the re-emergence so the UK story, it's interesting, but it's UK and Sweden are kind of are interesting case studies, but quite different from most of the other places. So the US didn't see a vaccine scare that was noticeable. Massachusetts didn't, and it's had the re-emergence. Norway has the re-emergence, and vaccination level has been at 94% since.
So it needs another explanation.
Yeah. Well, in some countries.
Yeah.
So obviously, the vaccine scare here in the UK is enormously important for disease dynamics.
Ottar, could you get the last slide back, please? The ridge on it.
Yeah.
You said that it matters because you get two similar parameter combination that could lead to the same behavior, but it would make a difference for predictions. Are you certain it makes a difference for predictions? I mean, was that based on a hunch, or is that something you really know?
So it's case specific.
But the reason I ask is you often get these ridges when models have similar sort of output. So when you have a parameter in there and two things given your data and given the dynamics that are relevant for those data, there are often various parameters combinations will give you the same thing. And it would also then mean that often for the predictions it doesn't matter, and in a way these ridges tell you that often is irrelevant. If that's not the case, if it is relevant, you haven't got enough data. Then you can't decide on the basis of the data you've got what is the case for prediction.
So I think I need to be specific about what I mean by prediction. So what I mean by prediction here is prediction in the face of changes. So we have the model, and we want to say, okay, what do we expect to happen if if birth rates halves or vaccination level halves or whatever, and you want to try to forecast into the future.
But if this is what you have, you can't do that. You can't make a prediction on the basis of this sort of...
Exactly, and so that's my point. We need, so the data, this is just, so I just threw this up as one example, but I think any of us that's worked with mechanistic models always, like, you never not have ridges in the likelihood space, am I not right? So, so I think, so the problem is that we need somehow to anchor, so that's exactly my point. We need to anchor it. That particular data set is not going to allow us to anchor it. Brian serology might be able to anchor it. Other things might be able to anchor it, but we need to really focus on that thing.
But I think I can see your point that if it matters, then you need to anchor it. But I think it's also important to realize in many cases it doesn't matter. This means there's an element of the model that is hardly affect the dynamics you're observing. And in many cases, you don't need to worry about it. Your answer is somewhere on the ridge, and where it is probably doesn't matter.
Yeah, but let me take this case study. So I agree. Sometimes we are that lucky. In this case, this is the estimate of the intra versus interstage rate of transmission between juveniles, adult, and adults, seals for PDV. And obviously, from an intervention point of view, and management point of view and prediction point of view, it's obviously going to matter whether we are here or there.
Is this just another? Are you repeating Tom House's call for us to link these models up with more and different kinds of data? Is that what you mean by anchoring these things to data?
I don't know how well. So I'm not. So I'm just highlighting the challenge. I have no solutions to any of these challenges, but they're very, very important. And there's some cases where it doesn't matter that different parameter combinations make will make you draw the same conclusions, but very often it doesn't. And so,
is the next speaker about to get set up? So, Julia.
Thanks, Ottar. I enjoyed the journey, and I haven't quite seen it all like that. The sort of thinking that models and being ambitious enough to forecast, and then discovering the simple models do the job. The question is, should we just sort of think, well, that was lucky, and not worry about that too much more, or should we be putting more effort into understanding why these simple models do the job? Should that be on the list of challenges, or do we just go ahead and use them?
The latter. I think what I wanted to illustrate with the journey is that I just wanted to stress the enormous amount of agony we spent. We spent a year trying to understand why we didn't think the simple model should have. We think we should have learned something from the simple model, but we didn't think they should work. And when they seemed to work in that particular case study, that actually was a troubling thing in a sort of Norwegian Calvin, Norwegian Calvinesque sense.
Actually, just carrying on the same points, there may be points when you have the more complex model, so you have it's not identifiable, you have your ridge, but you can make a better inference and a more correct inference about predicting what's going to happen when you do one intervention or not, than if you use the simpler model that is more identifiable. So if you think about your task as being to assess whether you realistically relax simplifying assumptions, it's going to change a particular decision that you're going to make. That's on the basis of which you want to anchor in your terminology.
Yeah, so to go against the simplifying vein that seems to be going on, that's kind of pushing back against the success that the engineering and physics disciplines have enjoyed over the past several decades. They have definitely not gone in the direction of simpler and simpler. What do you think what's your argument that you all are different and that you can't learn from that success, I guess?
I'm not a physicist, so I can't comment on that. Anybody else who's a physicist can comment on that, perhaps.
Okay, final talk of this session for tea. Tiffany Mulgate from Princeton.